Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Shakil, Salam, and you're watching Ummah channel. This is the special program for month of Ramadan, Healthy Bites. It's a Ramadan special program to looking after your health and well-being during the month of Ramadan. We bring the host of health professionals to talk about various topics relating to healthy eating, health and well-being during the month of Ramadan. I'm very pleased that Dr. Pervez Muzaffar has joined me. He's a local GP and he's a contributor to Ummah channel during health shows. So we're going to talk about generic health related issues. So Dr. Saab, Assalamu alaikum and welcome to the show. How are you?
I'm fine, thank you.
Right, thanks very much for coming. Let's talk about Ramadan. What are the health benefits of Ramadan? Because, you know, like people normally, when you talk about health, it's always people think it's bad for your health, you're going to be starving for the whole day. But is there any benefit in terms of your system? Does it get any better or?
I think one thing is discipline first.
Yeah, absolutely.
Because you're very disciplined about eating, drinking at the same time and not beyond that time. The second benefit I usually find for myself is I start losing a bit of weight, which you try all the time, dieting, but you do lose some weight.
But I heard some research that some people actually in month of Ramadan, they gain weight rather than losing it.
Yeah, it's the fear of not eating during the day.
Yeah.
So what you try to do is you try to eat same amount of food in 6 hours, even more than that in case I get hungry. That is a theory, eat more and more so I don't get hungry. It doesn't happen because by 12 o'clock you'll be hungry anyway. So people, and on top of that, we all eat a lot of things with fat and etc. So if you are consuming a lot of fat, if you are consuming a lot of food, then of course you are going to put on weight, because what happens is most of the time people in Ramadan, they don't have the same level of physical activity because you don't want to go to exercise because you get a bit tired and dehydrated. So your exercise is not happening, you're eating more food, eventually you're going to start putting on weight. Okay. So the message is, before Ramadan, during Ramadan, make sure you don't increase your food intake. Yes, increase your fluid intake during that 6 hours. That is a must, because you drink more and more fluid, flush your kidneys, that's fine.
So you're trying to say to us that in Ramadan, especially iftari time, don't bring loads and loads of food. Eat normal food, eat healthy food. What about fruit? Are they good?
Fruit is fantastic.
Yeah.
You can have as much as fruit as you want to, as much as veg you want to. But anything like samosa, pakore, jalebi, all these things, cut it down a bit.
And as I said, Jida, in month of Ramadan, there are some people who are on regular medication. So if they're taking any medication, do they have to stop taking medication and fast?
No. Never stop taking medication without consulting your doctor. The reason for that is you are on certain medication for some reason. Yes, if you're on medication like you've got backache, you only take coconut occasionally, that's not a problem you can take during that phase. But you have got heart problem, diabetes, thyroid, and all these chronic problems, then you must talk to your GP, because you've got only 6 hours. How you're going to take the medicine is very, very important. So diabetic people, I don't say don't take medicine, because you'll say, I'm not eating enough food. Yes, the medicine can be changed a bit in dose, but still you need to take it. Blood pressure tablet, you'll think about, I should cut down on blood pressure tablet. No, speak to a GP, get the blood pressure done during Ramadan at some point, and then the GP can adjust it. So do not stop medication without consulting the GP. Don't assume that because of this I can do this. No, they're very important medications.
And as I said, you know, some of the key factors, when people during Ramadan, you know, that are, of course, patients come to you, and what are the key issues there are? Because one thing is, you said, you know, when you don't eat or drink for the whole day, it actually changes your system.
Yeah.
So fluid is really important.
Fluid is very important, especially for the diabetic and other people with the kidney problems. Then you have to think about, you have to have enough fluid to go through. And if you have got a really end-stage kidney disease and things like that, then you should think about what I need to do. And the most important thing is the GP can tell you what is your kidney function and how much water you need, or you can go for fasting or not. That's important bit, because
Absolutely.
that's a health message.
And as I said, your doctor will advise you on your medical point of view, but seek your advice from your local imam. He can tell you about religious point of view. But we're getting a lot of question relating to fasting and health, and people who are on dialysis. I mean, my understanding is they shouldn't be fasting.
No.
But if people want to do that, that's not very safe, is it?
With the dialysis, as you know, you're very limited with the water, you're very limited with the food intake, you have to take medication regularly for it, and just a bit of change in your salt level can cause catastrophic effect. So for the people on dialysis, which is end of the kidney stage, what we call is a kidney failure, complete failure, then in that case, you need to have enough water to go for dialysis. You can't have Rosa in that.
Okay, so there are key tips. Also, people tend to not do any activity at all. They just want to rest all day. I know exercise is probably very heavy exercise and not recommended, but do you think just rest all day is the only answer, or do you need to move around?
No, if you think about when Islam came first time, there's no indication that Huzur Sallallahu Alaihi Wasallam said that you stop doing everything. He never said that. He himself did everything in Ramadan. Other Ashab Karam, they did all the things. So why we have changed that? If it was that beneficial to rest, it's just what happens is we eat and we get tired, we go to sleep. But make sure you do the regular routine things, what you do, and routine bit of exercise, what you do. So, and Tarawih is also a form of exercise.
Absolutely.
Where you're doing about 45 minutes of intense activity. So, but just continue to do a bit what you do. It's going to gym for 1 hour is very difficult, because you get dehydrated very quickly.
And there are some gyms now, 24/7 gyms as well, so people can go after Aftari if they're really desperate to go to. But I think important thing is that what we need to do is we need to look after our health and well-being during the holy month of Ramadan. Because if we're going to be fit and healthy, we can perform our tarawihs, we can do our fasting, and we can be a good Muslim. I mean, people are talking about, the things like when people go for blood transfusion in hospital, people still want to do fasting. But blood transfusion might, I know it's like religious question. What would you, I think they can't fast then technically.
No, with the blood transfusion, it's very difficult, because it's a disease which could be very fatal.
Yeah.
And the transfusion itself is a process where you need to be well hydrated rather than dehydrated. So for blood transfusion, I would say on the day, you really can't fast.
Yeah, and as I said, we're so used to our eating, then it takes a bit of time to get used to it, isn't it? Because it's the whole change for our body. But what is the positive impact of fasting? Because does it drain your system? Is it like MOT for cars every year? Does it do any good to our body for not eating for a whole day?
We have got enough reserve of the food in the body. Most of the people have got enough fat in the body to burn. So what happens in the first 6-7 hours, you burn the carbohydrate, then you start burning the fat and burning the protein, which shouldn't have any detrimental effect on the health, as long as before Sehri you have enough fluid in the system to get rid of all the wastage.
Any specific food, because people with asthma, people with diabetes, people with high blood pressure, cholesterol level, is there anything they need to avoid?
The same principle for anything. Like if you've got high cholesterol, you're not going to eat samosa, pakora, etc. You still have the food and health eating with all these like British Heart Foundation, they produced books, also book about it, how to eat in Ramadan, etc. Same with the Diabetic Association. They will have some food on there as well. So it's just a common sense rather than a strenuous thing.
So not eating too much.
Yeah.
Mind you, you don't have time to eat too much because it's very little window of eating. But fluid, you talked about fluid. In Ramadan, we have a habit of, rather than drinking water, we go for all these fancy drinks and milkshakes and everything else. Are they good for our health?
It just causes what we call is a sugar surge, and that sugar surge can make you very tired actually. When a lot of sugar goes in the body at one point, then that can make you very tired.
And as I said, you know, in month of Ramadan, it might take us for a while to adjust to the timing and system. People probably don't have a good night's sleep. They get very tired. What are the tips for people to?
I mean, the tip would be, if you're eating, then eat small portions in 6 hours divided. So you have iftar, then you have tarawih, and then come and eat, and then sehri. But during that phase, try to drink about between 2 and 3 liters of water.
Okay.
If you're drinking coffee or tea right at the end of sehri, then that might dehydrate you very quickly.
Okay. So
because caffeine is a natural diuretic.
So water is recommended?
Is the best.
And drink as much as you can during sehri time, and aftari through sehri, drink as much water as you can. Just to let you know, Dr. Muzaffar is with me, and we're talking about healthy tips for month of Ramadan to give you a healthy feeling throughout the month of Ramadan. It's mango season. Aftari with mango is good for diabetic?
No.
People with no diabetes, it's
That's
okay?
fine. That's fine. Because it causes, as I said, sugar surge very quickly.
Is it not discrimination that people with diabetes can't have mangoes?
They can have just a piece of mango.
What are the fruits? You know, because we always hear people with diabetes always asking, you know, is there any good diet for them?
Apples, plums, bananas, and etc. They're fine.
They're okay.
Yeah.
And in terms of food, any recommended food for month of Ramadan? What would you suggest is?
Same thing. What you eat normally is just cut down on your fat. Nothing more than that.
And as I said, you know, sugar is everywhere. Even the biscuits are sugary, but it's got salt as well, as I've been told.
Yeah.
So salt is no good, is it?
High quantity of salt obviously causes blood pressure, and people who have got high blood pressure, they need to look after their salt content as well. So when you're buying something over the shelf, just make sure you look at something called sodium level in it, and which is a common salt. And the other thing is, when you're cooking, try to cut down a bit.
Okay.
We do need salt. I'm not saying go completely salt-free. We do need salt in the body. That's most important.
Also, there's some question coming in. Some people actually use alternative to salt. It's not alternative to salt, but different version of salt which are available at the moment. Pink salt or sea salt or different types. Are there any?
There's a common salt. What we use is called low salt, and low salt is based on potassium, not on sodium.
Okay.
But the people who have got kidney problem, they should not be taking, because that can cause problems. So low salt, which is potassium based, don't use in kidney problems.
Okay. And as I said, you know, in terms of fruit and salad is good.
Yeah.
In Ramadan.
Salad, you're allowed to eat as much as you want to. No problem with that.
Okay.
And a lot of people, they have got these chana chaat and things like that. If you don't use a lot of fatty yogurt in that, that's quite good. Chickpeas.
So chickpeas are all right.
Yeah, chickpeas are
What about parathe?
Parathe is as bad as you can imagine.
Okay. Can we have just tiny bit? Or
Just a bit.
Small
One
amount.
lukma.
a small amount. Okay. And samosas and all the fried stuff you
Avoid it. Because sometimes we say you can avoid it, but then you go in somewhere, invited somewhere, and you can't go there and say, don't eat these things. The best thing to do is have just a small portion and try to avoid big portions. Don't eat 6 samosa, just have half of one samosa and
Yeah.
more fruit in it.
And I know we did the whole program on smoking with you earlier on. Just in month of Ramadan, how important it is for people to think about giving up smoking?
I think this is the golden opportunity. It's like somebody is waiting for a final, and this is the final where you can say, right, I'm going to succeed there, and you are going to succeed there. Believe me, because in Ramadan,